Yo, Yamamu, Aqua Baba, Echo Radio. So, I health and wellness from Masugusu Mutie. I do Sunday say, yeah, they say the whole world, but be a befabiano. A health and wellness and Kwan, the only show, a bit to me, in terms of health, the baby, I resume baby, I could be, and I don't want to be a Kamwasem. I do Sundays, I am from Chicago 10 to 12 p.m. I don't want to come once more. Of course, we are I go pramazo for no yeah, my cousin on the crew ever, but to say no dear health once some near Becca. Yet to make health once more Brian and Uncle Pons to say, oh boy, who buy baby a coso. Tiboni be last week in also so fan chairman here. Dr. Forest also to move born come up to Dr. Forest also I did not see baby. Of course, Dr. Atonso so I say no yenny cancer series, you know. I'm saying I see baby. And the Aquago Jenka to Aba, you buy anyone, I just said no, the can want some breast cancer. Breast cancer. Last week, you know, you can prostate. And then no, you the breast and so to us, so not just say you kwan kakanka a cancer series, you know, you twas one. You Jenka to Aba, everybody says here.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Penny Kanya or more. Say, and you'll be bribby, any ubi, no more be bribby anywhere why you need. Abusia, a bread to say, so be bedroom up wall. I'm out a crown far. Now only a communicant with me pa. Well, remit. Any Nidia a year to a fat sick assembly. Only more bebre say, modern with Juma Ding. Any modern dear I will say over my if you phone so a whom I won't. And indeed, well, remit Eddie and she said, Pa, Egua Quamu, so will be to me Eddie Sika Amani if you for our other for a console, computer, smartphone, and answer app, or how biara anything. Say we are a new customer, and I say any dear Eddie can quandia at have you what then, and it's over to me Amani Sika, free bone to our untia, a wash, Emma, well, remit. San and prince of 3 times, umpewe na open, Jane, and just some, and it's over to me Amani Sika. Akusi MTN and as a Ghana network Biara Swa, how Biara anything. Well, remit, we are summon Shampa.
Yo, yes, I am a more aquaba bio, so the music I can about radio. So, Safena, I'll do a feeding at to her, your life for Facebook, your life for YouTube, your life for anchorradio.com, your website and say your life for Sassing your life for tuning, but be a social media platform be a follow piano. Oko no more Anchor Radio, yo. And then also them make a candy any Dr. Cletus Baidoo and I ever treating como afa breast cancer and wasem. I'm saying me kind last week, you can be before a prostate and no doctor be okay through not just say the need and so aso. And my man doctor Akwaba. Doctor Baidoo not say
Nyame adom na onso
nyame adom bɔkɔ mehwɛ sɛ de wɔsi abɔ tie na wagye sɛ pink o sɛ purple mɛma no yam sɛ yɛ color blind nti me deɛ mefa no so I excuse nti menya agye a menim color pink o sɛ purple ɛgye sɛ biae wonte ase nti yɛbɛ nyankopɔn ase sɛ wɔde yɛn so asa aba back last week moka breast I posted to once na mene ha nti and then answer na yɛbɛka cancer breast cancer no ho asɛm no wobɛtumi wɔkɛ through kakra sɛ cancer no koraa de sɛ na sitie kakra briefly na watouch on prostate ne kakra na afei de wia ne the breast cancer no ato aso sɛ de bɛyɛ a obi wɔn na sɛ afei na wɔ join series here obɛnya bibi kakra frame
yo ma me share my screen yi.
Okay,
so you can show me screen now.
yeah, sure.
Yeah, so we show what's that say we show on me
yeah also
yo and then no say a tie for edi kan ni chia mu nyina me
I think for nyina agye so
yeah any affair for say you stream unti no
yeah
I hope so be a ho ye last week no you can be about you started with say cancer cry any day say what is cancer now the other started is say so the way Yankopon si ball ade na nyame abode bia no obo no orderly o hye bibia pepepe enti na tire no kra me eti ase say obo wie no hwe bibia no say everything was perfect enti no sa pictures mienu ya mi show yi a form de no e show brick wall ya hye bricks no very neat, tidy and organized sa pepe na nipadua akwa no netie ye cells no a very organized ocean under microscope a very organized enti sa nya me hye no na say be cancer na bibi boni ba nipadua akwa mu ti say cancer na a creative disorder nti wo hwe sa picture ye wo sori a won say there is no pattern hwe break we a diagonal we horizontal ebi wo krampo a vertical to say we there is no pattern enti no picture we na I say we are normal the form dey na normal esoro dey na ye be found say cancer na say wo an artistic rendition so ni say normal normal na a form han this side maybe me arrow ni point me nim say mu me arrow na
yeah you know nyina
okay me arrow ni point normal say nipa ye cells say be all the fat all the share your tissues no the share microscope asia very organized it's a brick wall na a nice brick wall na me show you niti nyame ahye bibia fe na said the sit down is your two foundation or she said cells BFN basal cells nti for most cells and basal cells and no na is a foundation but a woman cells ni bi nti no na aye cancerous na aye cancerous I would say we the nucleus in kakraka compared to normal cell aye kakraka enye organized nti na say aye destructive na say a course yes and say grow na say enyam breaking through the basement na and I say basal cells na eno na ya ka say a pre-cancer and a pre-invasive and I say in situ carcinoma intino no eno no ohwe suru die ya esuru die no sa cancerous cells ya eno nucleus ay blue no afa die aye kese pa compared to form die ayekesie ina ebi enyini kosoro in a business a breaky through foundation, you know. It is a cancer cells a breaky through foundation that's a spread here and you say I invasive. It is no by definition and then a cancer. Say a young breaky and spread here na nyini within that local area in the tissue now. And no, a invasive cancer. And non by definition in a pre-invasive. You say ujana obey cancer or obey spread it. And I say obey cancer, but by definition onyanya cancer. Last week in the year can say we statistics we about US and we share America American Kwan. I say more than 1.8 million new cancer cases were diagnosed in 2020. Statistics no a predict the year you be 2021 statistics in see nyama out into winning as a lag behind because they have to collect the data no into the American and be mostly 2020 maybe I do maybe make 2017 as but so the year 2020 now or say in America more than 1.8 million people will be diagnosed with cancer. Now, 1.8 million people were diagnosed with cancer in 2020. It moved 606,520 in the Mbewu because of that cancer. It is 606,520 people an idea. And last week, they say, Fancy Kumasi Sports Stadium, a fan paper say approximately 30,000. Be a transit comfortably, emphasis 30,000. No, first 30,000. One born a mark 1, 2, 3, 4, 5, sabe 20 times, and then I'll be near base 606,000. It is 606,000. With cancer in 20 or with cancer in 2020. No, a mube say 1,660. I mean, what I'm trying to say is say, 606,000. Who breaking it down 1,660 in a woo every day. In a woo year every day because of cancer. In America Hanomon, Yadia Kumipanyina #1 Ayakma Yadi. We have my Yadi free one and cancer in a tosumino. Last week, share a mema cancer and a cancer kum mema pa no cancer mema pa #1 a prostate cancer any can wasem and then no cancer a ma pa #1 a breast cancer a mema prostate cancer na year #1 uyi no free one man na ba long and that's a yahra one be a humefano. Any Broncos, no, and only #2, and only a mema pa, so #2. So long, no, any Nasa one, and no one soon a mass #2. And a cancer mema, a toss #3 for mema and a yen suno kesi and no colon and rectum. And no one soon a toss #3 for ma. But so what shed ye kum ni papa dear. #2 no. The mema a toss #2. Master #2 no. Or jumpo #1 for mema. Was a jumpo #1 for ma. It dear kum ni papa estimated deaths no. Lung cancer #1. It kum ni pa more. Even though prostate is more common. Lung cancer no unya bia a friend say like men can say lung cancer the kumnipa more both a man and men man na #2 no na be prostate for men man #2 no na be breast for a man and last week you can say prostate cancer no a man mani prostate I take it back a mani prostate a mani prostate until a man prostate cancer mema yade because at the end no event saying unibia you can't have the disease tissue no a man no mu ni bi nti entumi ankoba sɛ ɔbaa nya prostate cancer. And it normally, the American normally. Because in life, there's always aberrations and as exceptions. Now, Osha fence breast cancer, men were a new fool, a man also were new fool, but a man new fool, the tissue, no. A man a breast tissue a much more significant compared to a man. In breast cancer, and say, breast cancer. Predominantly a maya DNA. It doesn't mean say beman to me breast cancer because members no yen so ye wo enufo unlike prostate na a man no muni bi no. Now say me to also with breast cancer Mr. Kwame say do we be na say a question bi wo man na say bi upe say me explain bi na was stop me why.
Anyhow, yeah, no one time wa.
In that figure here, me shows CC from 2017 figure and US animal, and it basically summarizes the medical kind CC and say, any all types of cancer for both a man a man who can in a boomer. They're more frequent. They're more a man breast cancer. And for men, man, I say number one, a prostate, a man, number one, a breast, but breast, no, it happen more than prostate. No. It is all ranking cancers, a breast cancer, and then number one in terms of frequency, not number, and I say incidence, not number two, I prostate, number three, I lung and bronchus, number four, I no colon and rectum. Yeah,
Doctor. Now, was others now cancer now say lung cancer no and the community package and I just okay.
Aye.
But who show diagram in so who breast cancer pana a common. Now I didn't know it is a
no unse cancer bia ni suban on. The fact say bia obienya cancer being doesn't mean say that particular cancer become fast.
Okay.
Cancer be one many common, but when you be a straight death. For instance, say your type of brain cancer be and last week we mentioned it briefly. A friend glioblastoma multiforme GBM.
Of what I say, who cried the didn't cry just said Chihuahua.
Yeah, GBM no say no, and your common brain cancer, brain cancers and common, but then do.
Okay.
Oh, yeah, you need a secure into GBM.
Yeah, Doctor, I believe say as a internet, I for ponka cry. Me intimate na so ye. I'm say going out in and out.
Oh, sir.
But she said, I think say okay. Yeah, so that was so.
And America said last week, America brain cancer GBM say America said no they come John McCain and they come first Edward Kennedy. And then they come Joe Biden, about paying Bo Biden, and they come no. And no, into cancer be an issue. Breast cancer and a more common, same cancer be but what they compare long near more aggressive.
Okay.
Sana, I will say, fancy, say.
Okay.
Into a picture we know share, I'll say, a so far, dear Kumni Pana, can't say Kumni Padia, the chomp. Ghana because the champion or a lung and bronchus and the kumni papa na a mad dear not also into a mad dear no not memma dear so at also yeah into so our image we it show the trends of cancer deaths into social a line we now would say line winning represented a mark cancer no.
Mhm.
Line blue, dark blue line represented long and broncos. Into long and broncos, no sure 1965 mu ho no. A statistic shoot up sa to base fancy 19 mid or late 90s no more. In after they stabilize kakra na slowly na say aba from kakra. The entire any long they can want some but bibi one my this which na say obi at no say. The entire 1965 one no is started say shooting say. So 1960s more na in America that was a year pia such a social upheaval. Any a man so started years so a member equal rights we should to for so crampona civil rights in those that decade it was there was so much social upheaval. Now a man yes almost more fighting for equality which is right, which we all support omo adopt mema suban boni bia na mema omo ka so mu yesua tra nti no mema suban boni se de cigarette no e ma start so mo num cigarette pa nti man the numbers in eshutu up sa and also no those times na cigarette industry no my so powerful nti no ma convince am for say actually no num joten konso cancer bia. But awareness about say George so cancer and education can plus increase screening and a man numbers and start to say from slowly. Internally for long no. But do share breast my second red. Breast in terms of like nipa breast ekumom stable for so many years. Till even say around 1990s, and I fancy numbers in I say down in terms of as a result. It's a better one, but in some reason, mainly due to education, screening, say a yearly mammogram, a madu certain age, almost 30 years, and a catch nipa bebrinana, and son even say 2 more na start ya na ya detecting in term ni tu ase nti yen chen ma na be cancer ni tu ase na this picture here me show you a picture of oba enufu the way I hope on share no me I say enufu aye peel skin no off on it is a kawu peel skin off na wo hwe deeper ne nipple ni and ducts you find lactiferous ducts like and then milk fm one oba say so wawo foforo na ne body ni produce milk a produce milk na this part lobule and a lobe Intino a produce milk na a fat duct when musa na the ban nipple until baby no a latch on or sakia na say milk and a flow from all these lobules no so on so we need a na lobules no they are made of cells and I said they are further organized into BBBFN say ductules and breast ducts and then the chain in a measure picture be a more no further into obanu for no so breaking it down pass a dear pan a for a breast ducts are organized into a group who are a bibri kakrana a lobule na ducts no I said droben as a tube be a connected first lactiferous duct and I say tube be a connected ductules no to the nipple na ductules ne a lactiferous duct ni is embedded in fat Into oba no fu ankasa no say wo fa sekan na say wo dissect na mostly the ohunu na esrade ena esawo like most tissues in the body lymphatic drainage drainage na is say waste products no efemu to say the nipa yesi dan plumbing system no plumbing ye wo de di nsuo ba fie na we yusu na ewie so na de draining in a dirty water no eno no na fancy na de akosi sewage no ni nipadua no eno no lymphatic vessels they make any na hu hia na lymphatic vessels no it drew certain point bi on ma na a form a bibi round bi e fe no lymph node ebu on magana obu o ha say ejoa acheme eno ne the lymph I swollen na lymph node it play an important critical function say nse nyankopon na dwene na nyi nipa dwene ntino no a very deep and complex I brought here so I say even say in sufia and I say drainage in kebe draining from the breast rather than say a cut directly into like me finally man's term as sewage lymphatic lymph nodes na saying basically immune system ebi wo examine drainage na hwɛ sɛ yadeɛ bi wɔ mu ana yadeɛ bi wɔ mu na try sɛ be fight no na nyɛ sɛ ɛhɔ na na ɛkɔ lymphatic like a system no the rest of the lymphatic system it in lymph nodes no very very important before sɛ mɛkɔ so koraa no sɛ mɛka wei ama etiefo na mo mo hwɛ no no yato mu stream sɛ so binya breast cancer na si yehu se ade no ya prove say invasive breast cancer the first thing you hear say e person yehu say aspread ana na the man dey hwe say aspread no number 1 say you hear say e drew lymph nodes ana because e drew lymph nodes man say e call the rest of the body because unlike sewage system in a way can be a sewage system crown so it is say abrucha no say bia abrucha de it say ubu nsuo fresh na wudware ewia na waste water na drainia ekokobo city drainage system no more treaty waste no na fe the only waste na saka ko bo the source of pipe water no inti sana nipadua nsusu tie inti sana lymphatic vessels no a clean waste no and I say waste no my back to the blood vessels no inti a cycle and inti the cancer be spread through lymph node no a etumi kosa na say that afide na ba pie mogya mu na from mogya ne de it can go almost anywhere and until say examine obi invasive cancer share lymph node to find out are there an Australian and there's a special type of lymph node be a sentinel lymph node and only the first point say cancer and spread drew lymph nodes can drew sentinel lymph nodes it should never come one. Yeah, into so breast cancer in US now. We need a summary of the statistics I medical mind say in 2020 no the year I feel no about 276,480 new cases of invasive breast cancer and diagnosed in America in the whole world. The whole world they just be break up. But in America no nipa best 276,000 and over in a diagnosis with breast cancer. Now, any man can breast cancer. 99% of breast cancer is man, but 1% is mema. In the mema, any breast cancer in 2020, no mere base 2,620. Now, fencing invasive cancer no. in 2020 no you diagnosed best 48,530 cases of pre-invasive just ujana be invasive cancer but as a yehun in term into bit ma so ano so ntem into no number near best 48,000 and breast cancer of 2020 nipa 276,000 in 2020 no emu best 42,000 in a year of breast cancer. In this 42,000 we breaking it down one na just a dodo na 99% emma 520. Now so breast cancer trend now say from 2007 to 2016 invasive female breast cancer rates increased slightly by 0.3%. And as all Shresenia is see kum ni pasusua. Maybe once again.
Yeah, doctor no musu. Na ono musu no. Opa yen konkoje and ura twaso.
Okay.
This message flow into the twaso.
Yeah. So mortality trends and as a quiet senior a kum nipa cancer, breast cancer ni kum nipa. Or say female breast cancer death no a peaky and I say a the highest at 33.2 deaths per 100,000 in 1989. Their pattern in and say 1989 in a breast cancer a kum nipa do pass since I started say ye record and ye keep statistics. And then since 1989 to 2017 a decline from 40% to 19.8%. I say in 1989 na omunya breast cancer na move 40%. So 40% is close to 50%. Until they may fancy say a nipa bese okay, the member say nipa bese 10 in the MR 10 in 1989 and earlier no in the breast cancer a move 4 a breast cancer until any 1989. But they say no and say MR 10 in the breast cancer in 2017 and I say would extrapolate back 2021 MR 10 in a breast cancer rather than say move 4 in the bewu they say move 2 in the bewu. It didn't say almost say you have like the number of deaths from breast cancer. Now the reason nipa enkum nipa dodo compared to before 89 and say you screening a lot. Say mammogram no you screening a man. Number 2 say nipa bebre aye aware education of breast cancer and then the symptoms and nipa bebre na nkasa no omo pay attention to omo body no e ma bebre na esa until I say BBS at in the body more no nkasa to me epic say I think we men kan say me feel first me feel menufu a in kan say na BBB as a joa bi ana say BBB not jobi she hanom Sadi any my Franco me doctor, no catch me doctor now on looking into it. Until there's an increased awareness. Until yes and now for Barney pay attention and no draw the doctor social attention into say anything be a statistic a develop cancer be a statistic develop only a one in 10 until you pre-invasive time net yakutu see and then let's say for the most part so and also another reason say treatment of course in dear also into enura ye treating I better where you treating na better. Even surgery cry ye no cry na better. It's ni na so boa na ama enkum nipa dodo since what to compare 1989 honma. So what can we nyina about improvement across offense US and America hanuma just say and now say improvement in no nipa 375,900 wasn't komu no every year bia no mu. Yeah, it's a significant improvement. Yeah. And you know, say from 2013 to 2017, death rates, that's a different death rate and decreased by 1.3% per year. Okay. Also with a mortality trends, you know, say medical we say breast cancer, and then the second most common cause of cancer deaths in the US. 24 enya breast cancer about the same as abrofoma. But say 22 ni banya breast cancer, the chances say breast cancer no ebeku no higher than abrofoma. Me say repeat biom. To doom for and as a black women, omunya breast cancer about the same rate they say white women. But black women die from breast cancer at a higher rate than white women.
What repeat? Now, me add internet sir.
You better a training fencing in the presentation. Okay. It's high. But what am a brief answer? No, because I think it's a pertinent and a relevant question. The reason in a multifactorial, say if I say multiple reasons, but number one, the disparity in healthcare system in America. So what America no one dream say one obroni like about healthcare you be sure tuntum ni one broni about healthcare apomodin a you show the same rate or that and you the same because they also say nurses ne doctors ne hwan more hospital no or they are part of the society no racist and biased tendencies na omudi enyini no before so be doctor before so be nurses ewoni mu still ebi won ma nyese buapayo antina events you feel be say on can say unconscious bias na dwene nche dan eni so oye bias but aye ni su intina offense ebianka oba bia ba or say doctor me hu bibi e wo menufu inti me pese ye kohwe ade kro oba no complaining no me say black woman be the cancer brony the next day brony woman be so about on say doctor the same exact statement say me hu bibi wo menufu inti I think say we say ye investigate more likely say doctor Nebeka share brony ban say oh when will be you and from the yanko MRI and I say yanko mammogram more likely so catch a brony ban sir than so catch a bibini ban no say oh what there for like pay attention into Kofi next month and then next 3 months no abane ahe into so na cancer I just say like we say tutuni ban no Indian no like a bit
invasive, yeah.
Until the biases medicine mo. Another issue is say insurance for say a society is such say minorities, they tend to be like poor, less educated, and like less wealthy. Into the go on no need minority, no need insurance. But also majority na brofuna no the opposite is true. Into or no say bruni ban say no a likely more likely say on or insurance. Medicine so no you say the nkwankyɛn adeɛ afei yɛde sika na ɛyɛ test a yɛyɛ no nyinaa expensive nti no sɛ wowɔ insurance a na yɛ sɛ ɔmo nim sɛ yɛyɛ ɔsaa test na at least someone's going to pay for it nti ne nyinaa ne yɛ part na wɔ California no ndɔs woman bi a no yɛ Hispanic woman onya ohun sɛ biribi abɛda ne nufu mu na oni insurance nti no wankɔ ankɔ check na we na okoye no a hairdresser we na okoye adwuma na me colleague ba ko bi okoye so onkoye ni ti nti no okoye ni ti oba o me colleague ba nti no oye ni ti no na aso nkomodie mu na oni so oba ne doctor na okan say me feel bibi wo manufu mu na okan no na bra o se me insurance nti no ade no feel be say bia say 6 months ni also no there bra what the bra county hospital you better check here my own insurance plan I just come now onim says own insurance at county hospital and they will still take care of you into a buy and that time na a tumor and started getting na ne kesi na be say golf ball kakaka na asa spread edru ne nufu mu and edru amami asa spread edru na motu mu lymph nodes no mu edru lymph nodes no na maybe a bit me as spread it further than it is anyone's guess. It might spread it baby break. And you know, some risk factor say a day and na increase obi chances say obinya breast cancer. There are risk factors, which we're breaking it down into two. Say modifiable risk factors. Modifiable just say which may who be. And a non-modifiable risk factors mean who be. Non-modifiable risk factors in a medical can once. You won't mean who be. Breast cancer a to no. Bibi anyone may absolute say me ka say bia ma o manyina no just say younger person because me who oba when you 18 years when you breast cancer. But anyway dodo na no ma a o manyini into oba bia no wunyini a na o chances of getting breast cancer no cost through usually from age 50 years and old and more and our chances say we have breast cancer and air cost. Nipa undwinya hwe emfa wo age into a non-modifiable risk factor undwinya hwe emfa. Wa wusu no undwinya ho hwe emfa say ye wo oba no. Ye wo oba na wo 99% chance of having breast cancer compared to be a your own bema. Only just 1%. It wa wusu no and so non-modifiable risk factors. Yewo genetic mutations be and also increase obese risk so in your breast cancer. The most common mediator mature no we so a friend BRCA and it didn't say BRCA1 but yeah can say be easy you can say BRCA1 and BRCA2. Some mutations so be will be a increasing the risk so your breast cancer. BRCA1 no so be was a mutation be on and yet just breast cancer and one or increased risk of getting or in addition to breast cancer or a higher risk for ovarian ovaries no ono so no cancer to me obi obraka one no or higher risk of is nkosua no so no cancer baby and I said the pancreas so cancer baby and I said the uterine cervix no like na wodie no cervix no cancer baby and I say endometrial into uterine corpus and also no or breast and I say ne so no ena o sa braka one for no no omunya breast cancer na na omu higher rate so benya triple negative there's a chain make one say triple ye diagnose obi say onya breast cancer ye test person who cancer ni suban that the most popular test in ye hwe in hormone receptors into no estrogen progesterone any back could be different hair too new into some we no omo braka one and some mutation and nimi and sani na tested negative yes oni bi oni sa estrogen the cancer no any estrogen receptors any progesterone receptors any HER2 receptors now cancer is no and very aggressive and difficult to treat now Ghana in particular well known in medicine say your high rate of triple negative breast cancer. The other mutation in BRCA2 no and also increase risk for breast cancer, ovary no, pancreas, and gallbladder. You can say bonyono no. And also increasing the chance of cancer be woman in a bile duct bonyono a fat drobem a bile duct and also no increasing the risk of being cancer womb and also say skin cancer I melanoma the BRCA2 so the air no na bema bi ono ma and na me busu of feminine no was some mutation maybe into BEM mutation also or an increased risk for breast cancer in addition to breast cancer or an increased risk for testicular cancer.
Doctor Antosebe cry or shooting straight.
Well, yeah. And a prostate, the account was last week, and also an increased rate, and also pancreatic cancer. But the good thing is that most breast cancers, breast cancers, due to one and a genetic mutation, BRCA1 and BRCA2. Oh, I think say the numbers may kind but it should be about less than 5%.
Okay.
Yeah. And another risk factor so untumi enya ho hwe no say oba time ben o period esate for the first time in your life and also untumi enya ho hwe and it's a time o period na a chai we call menopause and for the most part I know some medications were on there but for the most naturally no enya na we control or internal and when we non-modifiable risk factors or on the period started before age 12 no the chance the risk is higher and the reason is say just say the principle on reproductive history is say the longer the first Obanon was exposed to like sex hormones, the higher the risk of getting breast cancer. Sex hormones near estrogen, progestin. No. Non-modifiable risk factors a being say having a dense breast or baby one man naturally a more drew. Obiso one man nenufu no like a softer peche. Or by nenufu dense or risk higher risk will be develop breast cancer. And part of the reason here say or no screening with mammogram now a very more challenging to pick up like breast cancer say a developing because a dense. It is said the mammogram no infant says I say car when the infant say car light on or drive a match now or drive yeah also light and my who tree and my who dear cost war fence abontin winina but se ko ba se ukofa baby na se ebo is very air fog very thick fog utro light na unse dan hu tree bia sa na dense breast na aye imaging many fence more challenging and in also another non-modifiable risk factor. Personal history of breast cancer or certain non-cancerous breast diseases. Obi on man odi ke nya bi dada. Nti so when ya bi dada pain, when ya breast cancer pain, in na ye koyo surgery na ye treat you o chance o sabe nya biom ne automatically na higher. Nti no so ye risk factor. And also so obi on man o nya breast cancer, but no nya certain breast diseases be if I say a typical ductal hyperplasia and a form of cancer, a increasing risk for getting breast cancer. There are other benign entities as well, and that's even in DCIS, ductal carcinoma in situ, and your cancer per se, but ujana be invasive into be cancer. And in those things, so we will be so and the risk of getting breast cancer no so higher, non-modifiable. You say any BB about my say me ye BB na master pono per se. Family history. Busunya bi wo no ma na breast cancer ewo and also ovarian cancer ewo. Medical can say there is a genetic mutation be a BRCA. Intino no say ebusuya no breast cancer wo ovarian cancer wo ma na say e bia na mo chances say mo sa BRCA mutation here higher. Intino so oba ofi say ebusuya no or say oma nani kun nanu fu ho or so oma no doctor ya aware no mo pay attention na omo hwe ni yi obi so wo ho no ma na bibi ntino no onya bibi in the course of the in the life they say bia na lymphoma kunya lymphoma bi lymphoma so I say moja and as a lymph node the cancer onya lymphoma bi e bia na ayekese a na e compress a vital tissue ntino no omkoye no radiation say e be kum tumor cells until we exposed to high dose radiation to the chest or by exposed to high dose radiation, whether say it for lymphoma and also for a prior breast cancer or not or a risk of developing breast cancer, especially the most common one I'm developing angiosarcoma. And so on. Now risk factors are no bet my young BB.
Yeah, doctor, yeah, my main stop on the Konumsu Kakrani, Yanko di Draka Kramra. So, yes, stop all by beer, I risk factor with my young baby. No, the banner I pick you up from there. So, the bear, I bet my mouse so time Kakana, I was with me, I catch some breath because and then so what Wakasapa and see. You think I told Bana, ya refresh your Kakra.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, yes, I'm Kwaba about go radio. So as I found out what video to her, I am Dr. Cletus Baidoo, and I had to think more breast cancer once. Now what church in baby, what my statistics, you know. So they sit here and one when be a bit me a coon in our church in when I said the address were yet was no breast cancer no risk factors now. With my who be no. I don't know. Is in your drew on more or church or church to us. And to Doctor to us my
You Kwame Midasi, Dr. Alfori Sumichia. Yeah. Into yet once
producer one.
Yeah, yet was risk factors about my own baby. The kind of make one seminal weight, especially after age 18. Or can see too much, you increase your risk for breast cancer and other cancers. Yeah, can be one like way back in the past. Like endometrial cancer, say about where can see PR risk for getting it in her. And make endometrial cancer briefly cry once a and can you know. So when we say we a like Emma say pathologist for say ye share ubi biopsy under microscope. Now say you who say endometrial biopsy, you who say cancer. What dream crowd because or your mommy penny would be at least 40 or 50 years and above. But see, I don't mean emphasize and operate. It didn't say see, I don't say Osha will be cancer. Now who say or me will be endometrial biopsy. Now who say cancer. Now question the age. Now we're younger. The next thing I say measure say ni BMI is saying. Uncle Henry no kakaka and BMI over the chart. Until modifiable risk factor, weight gain after age 18. When no bet my own baby, where DGA exercise, with my own baby. Being overweight or obese after menopause. Is that weight, weight, what I say after age 18 and I say after menopause. The reason fat increasing the risk of breast cancer and endometrial and other cancers, but me focus on breast and so the reason is say hyper fat and cancer is fat strategy Omo cancer no to produce estrogen. Into the more you have, next who expose your body to a higher levels of estrogen. And it's the reason I remember saying Ukraine say bema or soon obon say na nenufu krana na say ebobo because the body is exposed to like higher levels of estrogen.
Man go I'm no from grounds to change my idea.
Yeah. And the other thing is to say, fat natural body produce more estrogen. Obiso na and now so go to.
I've just said Dr. Forbes so observe.
Not per se. Would clarify the mami about we say your conditions be also so it mima obi enough for gynecomastia, like
gynecomastia. Yeah.
gynecomastia. So I know say nipano. I mean, does that also increase the person's risk when you have breast cancer?
No, gynecomastia increase nipa no risk obinya breast cancer, and gynecomastia no mostly a mema in enya. Because yeah, any mema no your breast unse yes certain maybe say me go back, but me show picture be say the oba any fu pale skin na see
It's yeah.
a mema de no ye nufu no obema like when you kra no nufu no ni stage e won it is say oba onyan go through fencing menses a very mature like in developers into no more when you gynecomastia and say no the way I diagnosing say those fencing immature doctors say adults. And but it doesn't increase your chance say ubenya breast cancer. Yeah, it doesn't. But the point I make come back is say estrogen no say a dose wo body no mu a na ko ye be ma na say enam kese ni ntin afi your body no kra no say your member your figure your natural figure my body no after the na assume to say the oba susu figure akesefo no and it's because of estrogen until no point for men and there and no point na me reason to be on my be ma be on man na man enu for abobo both na bo hwe ogina hon mu na hwe na chi a I say like when said anya say bia be ma ogina na so structure is because of fat na wo no na estrogen na produce. Yeah, and the next point, say, make I say fat in the end, and naturally, wild body may produce, but obabisu one man will through menopause. Now, menopausal symptoms now, fencing will go through, is so tough for her. Into yes, and to me, say, okay, so then you have hormone therapy. Or common menopause is because the ovaries na a man produce estrogen no kesiapa. Now ovaries na fed when you it's not producing as much estrogen as before. Now yes ana no munya sa hot flashes ne sa menopausal symptoms go through. Obi one man dey very severe, very tough for them. And yes, and I'm say okay, and it's idea, yes, I'm found to hormones, hormonal therapy, say the bear or symptoms in the bear better. But we yes, and so increasing the risk, say between breast cancer. Into that point in children, alcohol is a risk factor for breast cancer.
So that be a kasa, weight gain, alcohol, tobacco, no, it goes across board. You become once more happy, risk factors, weight gain, alcohol, tobacco, na sadly we I don't know. Of course, I have a baby, not salad, especially alcohol and tobacco.
A habit. Until I didn't say, be usu and ujaya edin. And then I said, bet me crana, don't even try it. But say, what you can't try and say, a warrior son, I order a tobacco, no jot, I order. And now, and Susan Swa, a benyama body, and it's a one, and emphaswa a need for body in educational Kwame Menu and Dr. Fori program, you want the ma yen every day into Chinaso, na fajai a sadian. Because obesity, I can once and can any alcohol. Last week, Dr. Fori Kaya, you can once them say prostate cancer, so no, obi or rain and san, obia, unya, obia, why can see. Omunya prostate cancer, aggressive. Intino it should all this, it should be a motivation. Say, idea maybe a sense, idea me nipadua nankasa no a toxin na me digu me nipadua. And apart from say say nipadua no increase your chance to be in term of cancer. Into identity also now some be an papa was say ne mame to ne mame, but or say the mame can say owo otu ho a otu baby oba ono ankasa ba before akọ nti identity also tutu ndika ko hia na kwan nti ne nema bi wono mo a say betime gyan a anye say betime gyan a yen momodin say ebegyan because wine na edi edem na ebi wono ma say bi a wakọ party obi enum den no nti wakọ na senka wakọ party bi na say obi yasa cyanide poison bi esi wono say oh obi enum di ubenom or say utriti say last week's me can say or say you treat your body say luxurious car say they be obi nye scalp koto Mercedes Benz krana or anopapa no ko hu no polish no you say no your body no a year be 1 billion times more precious and we can say complex same Mercedes Benz via we are say it is so we share Mercedes Benz oil change now we on time go compare time crown so crown say hey me can dey me fe ni agro san also say san na your car we body need there also you need be at times 100 and I say times 1,000 crown. Physical inactivity, it goes back to weight, couch potato oba a man na so soon exercise organ and dey very rare so we say I mean we be can be gym no very rare so we say Ghana need ba exercise but say Ghana kra na asesa it is all tia brochure no mo a na say offense bi a ko Ghana che na they also who say Ghana for no mti Ghana kra asesa say Ghanaians they become very conscious of like some of these health things into maybe your motivation may be different so say or exercise now look sexy in the but I mean in the long run a boy want health also. Modifiable risk factors in the yet was a B say oh no wait and I'm say
yeah watch it
yeah my children women shouldn't have been here menstrual long menstrual history and modifiable but the modifiable no say not having children to a large extent in a modifiable not having children or having first pregnancy after age 30. The longer you're exposed to all these hormones, the higher your risk. So by fencing any saying the body change, the chemistry, the hormones change. Into onion cycle boom or war for a number of months, onion cycle boom. That kind of rest a boa body in terms of like say a decreasing the risk for getting breast cancer now. And a high natural levels of sex hormones and recent use of hormonal contraceptives. We don't know it is safe for a part of a bionoma like high natural levels a natural idea I say a
non-modifiable modify
and but so if I say use of hormonal contraceptives need modifiable because a exogenous. Yeah, but the next important point in an ASA say oba wow now so ma banana breast milk man and fusu because so say onufu ni so no and no you are increasing your risk of breast cancer or say breastfeeding for at least 1 year decreases risk.
Yeah. But I'll check him home my so and this will be a breast milk and on farmer be as almost man be almost to breast pump no. Now I can for no the amount. I don't know the same as not breastfeeding.
No. So the pump in the pump here breastfeeding because any akola no any baby na no any magic being a woman now the katare so no na baby.
Yeah, because the time is a question son and I be a big jinse beer. A crown one for no no for no and they just one feeding.
Baby. So what the pump here you are breastfeeding.
Okay.
But obi on ma on pump because oba no fence or wo foforo na ne nufu no hihye na say baby no on so on pump here. Body no yakopon amazing thing o here about body say o feedback loop into a body na nkasa no e ka kire enufu no say enufu so ya o producing a too much into giant. You know oba on feed one go for on man ba enufu no and chebo na enufu so na enso twa but no na fence any good no so yes na no na we increase your risk say we your breast cancer and yes we pump na say ba out there it say the baby alachi on and never having a full-term pregnancy and it goes back to say fence long exposure to fence hormones no and we can alcohol so view. And to make better signs and symptoms, and so open some cost one, and I say be a question and a contribution be a.
I think so. Over to me to us.
Yo, and you know, signs and symptoms, no, a differ phobia. Now, a view on my friends and show any signs or symptoms, especially say early breast cancer. It may not show. And as I said, a type of breast cancer be an invasive lobular carcinoma, and it may not show much signs and symptoms. But warning signs about me a bina may show the picture. So I'll tell about when you know for ya. I don't know, say a clear screen so.
Yeah, very clear. As a while.
Yeah, I like that tree. Once I feel I want to be sure. I say the best year met me, I say because a joa be aviation in Nufum.
Yeah.
And not just say a joa be a breast cancer. Younger folks, like a mom, we are very young, teenage years, a joa to me born from usually around time of young period, and no, most of them by far benign. If it be fibroadenoma, a benign breast condition, it may be at any age, but younger, about young, who feel be a bibia by the most of them a fibroadenoma, a benign income, any or she. They say you just feel that a lump, and say about when you form. And no interest be or be a young, in fact 18 years. Not say or feel a long view on also or non casan fan and say just follow up, say be a hour follow up with a doctor and our nurse practitioner and necessary physician assistant and so on. Follow up. Because sometimes we are worried that better say a biopsy. You'd become a pathologist, no, because I did, and you also a worry, and no number was majo, rather than say, yeah, one number no BSA, I deal with could it be cancer? But the cancer say the youngest patient my diagnosing with breast cancer no d 18 years. Me name the family history, how is it? But most likely no at that age, just say be no BRCA mutations here, I make one same earlier. And also say a very powerful, strong history about man, which can be a breast cancer, won't be brave, and ovarian cancer won't be brave. But 18 years, no, but from or no feel no be one and from and doctor and the doctor in him said that age, the most common one, a benign fibroadenoma, it was so conabra. No conabra, nothing not of Lisa finally, biopsy na a breast cancer na as spread call the lymph nodes na one amoto. Another sign so obi betumi ehu say so show ba we enfu a kwame dey na won ho eye o makinkan ti ugbo hu. Yeah. And what I be with that one. Who say oba not normally or something nipple on the gina so
But that's a chukum.
achikum. And not just say obi and new for achiakum be and breast cancer because so be most one man naturally and achiakum. But what it mean the picture we mean say what the gina so in afa the won't say I say achikum and I say achiakum. Go and get it checked out. It's nipple retraction. It can be a sign of breast cancer. And now, Osha Oba with Nenufuna in the skin and I wahan no. Meaning some more appreciating well in the skin thicker than if you ocean the Nenufu Asia crana. Aka cree, no. Like skin award this area, it looks thicker than this part, and also can be a sign.
Yeah, and our class so I just color kakra. As a red kakra bi.
Yeah, I say I look orange on your even a French word peau d'orange. And no say no but I don't know for the minimum how I will present, but a lighter skin abroad both the skin area not or a change color like orange reddish. And I know saying a breast cancer. I mean a sign of breast cancer. And don't say you confirm more crana and like a higher stage inflammatory breast cancer. But anyway, another thing is what we say. If your skin and baby potty first na okay, but baby potty after the asset or no I mema come to say to be any dimple or na phenomenon. Na I want a mema come to skin dimpling. And this is no because what happens instead cancer no says a cancer no was yeah cancer it meets skin it on the skin na like it's pulling down into na also dimpling. Other signs and symptoms no mention the picture no a bisu say fence o feel say
Doctor Hassan Abako no so no I don't see in your patients the question be about some kind of one son was what is benign tumor and say is it the same as a cancer and as a mass will be concerned when DX with benign tumor. Is that terms no what I say?
When diagnosed with benign tumor. Okay, you can say tumor on words in America was in on my question lay acquire lay for social terms but in medicine it with different meaning. So because I'm saying tumor, who catch a doctor say you see who call hospital in a doctor hospital when you tumor. What shall I much information? Because who can say tumor and not just say a cancer. So cancer dear. Most cancers no jana a bit nipa na and as a bit must say tissue in that area no. Into cancer a bibia say body no a bit nipa no bit must spread it. And then a cancer. Tumor no but menya tumor no a tumor you divide into maybe 3 crampon but broadly need 2 baako say benign just say idea no uja na enya ade bekum enya ade be spread e be bit my life a bit discomfort and I say to am cause discomfort but enkum and spread it anything benign. Best example for a man fibroid or babiate fibroid pain so ba wodi awodi no fibroid tun betum fibroid no enkum nipa benign. A bit my kesi, pa one on fibroid kaka the same tea. A bit me pushy
Doctor Tidiason.
I'm it so. Yeah, I think I may example. Yeah, a bit me pushy, I push it down on if I say the bladder on and China Johnson Deno, and as I say push it down there's a bit of cause discomfort but no per se no enkuno and I spread it into a benign fibroid benign and I we can say cancer and I say a tumor beer and it's malignant by definition cancer malignant say a bit me kum it must spread it which me and spread the corner baby a one bit me destroy a tissue near a wall. There's a type of cancer BFN basal cell carcinoma. Abrofupa na because a skin cancer is the most common skin cancer. And you say no, and spread this a spread that could bring money other but ujana that be a done no a best say a tissue no wanted say be a be bruni be nim na betoa na phone na betoa. That's one kwame could train through on my enkuno. But the best say, but a cancer because it destroy a tissue, that area. Yeah. And I know a fancy the difference, Meaning
muda on do bit me out to us other risk factors.
Yeah, and other risk factors, But medical cancer skin discoloration and as a redness and as a orange. Obi on one and no, and as a nipple no. Almost a skin and I say why I flaky and then go and get it checked out. Obi or no more now when your nipple discharge nipple maybe or the same year so moja cry a womb and I say baby but it's a breast milk. But so bar will go for us or near for night say breast milk about and then big deal. But Sabia I fancy or like or bar or true like what child war na umiani nufo so na se bia nufo ano na se bibi ba se breast milk and na se moje ba from nufo ano na they should go get it checked out. It doesn't necessarily mean say breast cancer because there's another condition be a benign but increase your risk for breast cancer if an intraductal papilloma and a tie if I say issues are symptoms say the oban nufo no bi okumia na moja ba because of baby I want. I say Pacho say.
Yeah, I know Mohammed the question be about. But say your man san you move on. Was obusa say no krese. So mema anom mama no for omo ma ware no per se. Omo no for na prevent breast cancer so the na o kan no krese.
Me eno die e wo book mu dia men kan ye. Nka for mema na no mo poma dia ayo.
Adam dada.
Yeah, cause a breastfeeding a lower risk of breast cancer na nye mema. Yes, a breast milk no say be man no ba no for no breast milk bi asem bi ani.
Okay.
Yeah.
Okay. Yeah, and Mohammed I don't know.
And Beyonce last week here can we be a question say so only oba da lower is a name my favorite man yeah, another thing so say so about on your buy or so wanufu it drew a beer and as I be an upper cancer about mirror na wanufu. The more we show wanufu, the more now we are conversant with it. It changes be about what we do when Nikos and Kron say, Menufu, it looks funny from what I remember. It's a mammogram and a mammogram. I'm making sure to be behind it. Any change in the size or shape of the breast, go and get it checked out. Who feel pain? Oh, wanufu baby, go and get it checked out. Sometimes, and say it may be a benign, no quite any tumor crown, a be a cancer. A biana a friend saying, Odu unam, maybe I would do a new crack of ball baby. A heart, ouch, at that time, no. But after a few days, after don't say that, but a woman after the 1 year, yeah, just a tissue never maybe when you different fat necrosis, fat no crying, and I say a until you are feeling some pain, and I say it makes you feel lumpy. Go and get it checked out. It may not be anything but go and get it checked out. It's in another signs and symptoms or baby to me who own any phone. But I say, if you want ma, if you are fancy, signs and symptoms, and untina, you become breast cancer screening once and
Yeah, Dr. Ansan Abako, no, I think say you near Sister White, or the question be about no, but say, sleeping position to be our da. And then I'll be out down side and I'll be out to me down for soon as be a new for kakra bar, and no, no for soon kakra bar. I don't know, once a while, no, I don't know, just what chance of getting cancer now. I mean, breast cancer now.
Yeah, say, because signs and symptoms young Casabia, a nufusuo, a bibi, if you need to send nufusuo bar, I just say when you breast cancer.
Okay.
The other say, bibi a year unusual, biano no, a bar, cock, na yako check it out, but say, who could that one nufuso? Na say, chin no be a like a nufusuo be, meaning and the minimum how much dear, but nufusuo be about a year. Me, I'll go and get it checked out. But so we have regular mammogram there. Oh, and no, fancy. And I say, be a side and inch be now your next your yearly mammogram now. Don't panic, because Abiana and see our body in different types. If you want a serous fluid in any cancer, any shade. Like a crow too will be a drew be a crow and Cassandra was in a obi or the Sawa to swa. Now I soaked in a fencing in Subi.
Yeah.
And you say a serous fluid, and yes, a basically tissue, I break it down, any blood, I break it down, and it produces an issue. It is other one who say pressure can cause like the mechanics say fat necrosis to say they be a when I'm now do with food, when you pin be so one said that now, yeah, and that's what take care when be a seat belt, no, at the one who super and your cheap break being a press when you now a 1 year, yeah, a bit your mind in Suka cry if you will nip on more back. And no, any BBI just say when you cancer. But say, the American say you have to know your body, no. What I'm appealing to it's here for ne obi answer or baby and know your body, pay attention. Unusual. The answer they be out there when you for so. Would a fence would one for so and so be ama. If you say Yankopon ball, they were fusu now than to the one for so. It should be ama. All of a sudden, the past few months, would the one for so on sorry not say Uber brow and I say one more brow and what had and not. And you're normal for you. Until San America say go and get it checked out. Until it depends on circumstances. In him say Muda.
Yeah, that emergency Anna is in wine and tinge a cramana. I'm a time.
Oh, yeah.
A copper. Now, Mohammed, the question be by some question I think say on answer that. I was on the question how they by the Befriba Memman on Quan or Bisa. And but the question be I think so your mom medications for be a breast cancer dear, but no, because you will supplement be a bit more preventive breast cancer now.
A supplement in the bed is a woody.
Okay.
It's any Debian no a program in Moka.
Balance diet as somehow.
Balance diet. Would balance diet to make sure say nuts. Any vegetables very rich any fruits are very rich in your diet because food pyramid now almost selling my time was secondary school. I don't know say time agriculture and nutrition show food pyramid this animal. And no the they had inverted it. It was wrong. Yeah, because some of the meat milk is so critical. But the opposite, say fruits, vegetables, nuts, and then they're more critical. na first milk meat ni sa nneɛma no koraa no ehu nhyɛ dɛ nhia that much for nipadua no but nam say a western world no everything is about money marketing and nti no onye nantwie nti na bosi na I can say omo nye nantwie no normal association for normal lobby say oh there or say a pyramid say we nantwie na ma very very good for your body ya sell say there
Asa omo ye na ntwe nti ba mi se say
how they we yeah, breast cancer screening, age 40 to 49 years, or by age 40, age 40, I started new doctor, and now healthcare professional in 50 to 74 years, Now, so an average risk of breast cancer, a new Wobushi Kesi, Unya breast cancer, that mammogram, we normal. Or doctor any would be chance say okay to see an normal every 2 years in a bay. Remember and in detail shortly. Breast self-awareness breast cancer screening one of the most important thing in breast self-awareness because all the time you who say a man who pay attention to a body I want to pick breast cancer I mean can say lesion and kebe breast cancer we picking immediately na yakoye biopsy na yakotu afi won na so no so it so we cell breast exam ko jami room na wo show nufu a very very important screening na wo ye na wo feel we nufu no ni meka one say shortly clinical breast exam ye clinical just say like waba clinic and I say doctor na a nurse practitioner so breast exam but de no kra no wo de na wo ye no self breast who as a person do ye more sensitive saying the doctor and nurse practitioner because wo you should know your body more than a fancy doctor no obehu wanufu no a mammogram and so yeah a fancy where this screening in a breast MRI and then there's ultrasound and none of them but self breast exam say na oba also ye no bosumi bia once a month oba onya period 2 to 3 days after a period no na why yes breast exam no udi kan ehwe wonufu no first thing just inspection wo hwe wonufu no wo mirror mu na make sure say everything look fine. What should one more true because breast cancer a bit me start a more true. Obi one ma or as a friend accessory breast tissue or na more true because of the way our body is developed no a new tissue ne bi need one more true and until no otumi the breast cancer no start and actually a lot of breast cancers no started close to amotu no your friend upper outer quadrant a lot of breast cancers started intino no you ahwe amotu no u pagya on side to fancy bia utisi a wahwe amotu no do mirror mu na afede wafa fingers the next picture no fingers for ebia udi nkun kakra afa ho anasese wo shower masem na wawet na afede udi fili wonufu na udi fili wonufu na your three major ways out in the fili what me feeling up down up so as a zigzag sa or I don't know fancy one way and actually to me it's actually the best way how they do could between the fili wonufu then there's the wedge wedge in there o sate wo nipple na dey akosa na o dey akosi bia fancy with chest in fin na sa afa another or they call rounds into a wedge any circle and they call round but I think said the best in a win because we know also cover more territory be a bit missing with wedge and I say round and round into not a fencing and on a self breast exam and your mammogram no because mammogram a type of x-ray low dose x-ray you dey share by nufu no nti ye fa nufu na there are two platform bi so na mammogram machine na compressing kakra na yicha na fancy breast radiologist no wakohwema hwem so hu bibi abnormal bi wo ma. But mammogram no or say it can miss breast cancer false negative and no it may happen because bibi are not my perfect. Oh we are say and I say it can also appear abnormal false positive. The entire mammogram say so screening for any disease you want something that is very sensitive. Which my applique false positive cry. Now just say no the more sensitive and just say the less say more messy cancer. It mammogram is very sensitive. Now but it may say cancer, especially depending on the type of cancer may come back, could be say invasive lobular carcinoma. And you say mammogram with my messy. I say about 12% of women who are screened have an abnormal mammogram. Into your screening so offer a 100, a 12. No. Or mammogram, a better say a fancy a abnormal. But that 12, no. Who could show say, but only 5% of women with an abnormal mammogram have cancer. Into a sa nipa 12 no who breaking it down a move 5%. And I won't say mammogram no abnormal no cancer. And a false positive say are most likely during a woman's first mammogram because one thing about mammogram and a year in say they compare. Medicine because in fact hunting and born near money 2 no you want 9 you were an a into be sometimes in person say be wrong you compare to the other one na mo say ade we no wrong in sana mammogram reading it as a money good no or mo compare in a moment to me catch it anything unusual but so first mammogram there's nothing to compare with into no omutumi every day fencing wrongly because ebiana ade no fi say abnormal senka ucha mammogram if I say 5 years the previous 5 years and every year biana ucha kobon say ade na wo ho the same size and change here but we need that frame of reference into no or share now fi say a weird let's go and get a biopsy na okay na bibia cumulative radiation exposure and so concern. Even though I lose those X-ray because yearly and I be more concerned about exposure. But BBN a risk benefit. The benefit outweighs cumulative radiation exposure. It means person be a bit too worried. Say, hey, me koya mammogram and because they are worried about radiation exposure. Radiation is using a low dose X-ray. Into a face BBR. Also, we're too worried about. And also for women at average risk of breast cancer, no. The American Cancer Society, among recommendation is say 40 to 44 years of age. Between 40 and 44. You have the option to begin annual mammography, but you have to talk to your healthcare provider. Stratifying based on a history. I mean, quite fast. Time
into just say and our questions and so it keeps coming in.
Important into
very important. Your change until my age,
45 to 54 years and your annual mammogram. 55 years and older, and say by 55 years, doctor no sha mammogram be normal or between one discuss no I say a free neck every 2 years. And I'll say some women at high risk of breast cancer will boost you or back very young so it be me 40 be me 30 who breast cancer and no you to me the breast MRI the mammogram now you started at age 30 years.
Yeah, some question want to tie into the now can obviously at what age is the last mammogram in a woman's life? Okay,
when you see point in mankind saying continue mammography as long as overall health is good and life expectancy is 10 or more years. Because may diagnose breast cancer in about when you're 98 years.
Okay.
And you know, a breast cancer, you know, one of the non-modifiable risk factors in here, the more women, the chances of being breast cancer are possible. You know, mammography in India, usually lifelong, unless there's a medical indication be against it.
Okay.
Yeah. And you know, no. Nipa makase normal nyankopon body and effect crack under the microscope. Nipa obi an the breast na normal. We hear the microscope no say na tie. First lobules in lobes. In a way na make us even ductules no na nkete one cell layer in a basal cells be even myopithelial cells. Into we ni normal. Hwe obi an die no enya cancer invasive pre-cancer. We are make us normal.
Yeah.
Yep. That's difference. In say I just say you huno and term kakra DCIS. About more the akuchasi and say bia hormonal therapy be an man. Where invasive I spread it. There's like no order a number be the way to put my say lymphatic space. Just say I spread it to the rest of the body. And when I make us say, no, it's very hard to diagnose. I want to have uphilia or one mammogram, and soon, but MRI, no, it me pick breast MRI, and in fact, invasive lobular carcinoma. Then come out some case treatment, either conservative breast treatment, surgery, or mastectomy. In a fencing, use and it depends on the tumor. Say, I didn't as spread day in a patient, so then no pay breast conserving surgery. Say, ye be lumpectomy, yen chow no funina, be a tumor one, ye chaff, ye chatumon in a few body, and a breast conserving surgery. No, mastectomy just ye chow no funo. And a surgery lumpectomy. Breast conserving is the same as lumpectomy, mastectomy. And yes, as well, I say who says invasive, I say who say a do lymph nodes and a coamotum. Internet because a lymph node defend sentinel lymph nodes. And then the first point say is spread there, you can call. It's a doctor, like most breast cancer is a doctor. Internet and no, not ye chaba, only a question of microscope when we say cancer and a tumor. Say drew sentinel lymph node, after the or no, you could yield lymph nodes in a woman and even axillary dissection. Yeah, say how many of the lymph nodes in a cancer they drew because based on some information in the best stage, no, I can just say cancer this aggressive and this level prognosis no AAC. Be a cancer based on science AAC. It doesn't mean say 100%, but mostly accurate. And based on any say be a spread and they a chemo, say a pre-cancer, no, a DCIS and say be a hormonal therapy. They see an abefu, the abano immunotherapy. I'm sure it's in Uganda because it is a enjoy our check. Immunotherapy, it means you see immune system. If you cancer and characteristics, the immune system they are fighting cancer. And a radiation, and so basically last week I said radiation essential and yet the high energy beams in the person they fry tumor. If you want more cancer, no one more so much say you could try a problem. Into not ya kind of radiation, and sana because we radiation shrink cancer, and sana surgery. And radiation is recommended for most patients having breast conserving surgery. And on the radiation, find a crazy account just to make sure say a clear BBR. Because it's the end chow no funny and say a coil lumpectomy could 2 months on quadia. You say you make sure say you cleaning horn fry a high beam not fry horn. And for women with early stage breast cancer without spread to skin, chest wall. It should be chest wall or distant organs. breast conserving surgery plus radiation therapy results in long-term survival equivalent of mastectomy. Nti no mo no die no no ye fra kakra no omo outcome na say the obi akotwa na nufu ni nyina. 5 and 10-year relative survival rates for women with invasive breast cancer are 91% and 84% respectively. The reason is very high and they say and now mammography you're picking a very early stage into the spread into your own son the surgery treatment radiation now survivor at 10 years so only 100 they move 84% of that's what you say in 10 years because you won in term in a swan what now na a do na spread there and no be won 62% are diagnosed at localized stage with 5 year survival of 99%. But survival rate in Black women a lower, 9% lower compared to Abrofno, and it's because of an medical kind say racial bias, any insurance in Sanema the risk survival need lower compared to Abrofno. Makasa bebree, but breast cancer is sanity.
Yeah, well, thank you. Questions and me angasa na mo bebrebe na but yen hwe de Salima Poku Adebaye. Also, please, if a breastfeeding mother at 6 months feels a lump in her breast almost for 2 weeks now, but the baby is still breastfeeding, I know, because is the lump a sign of breast cancer, or is there breast milk accumulated there? Biana say Biana,
I'm going to say the question now.
so Obisa.
Yeah, but a very good question, Obisa. No. Salima Poku, our question is very brilliant.
I also hear from Fayase, Ghana, Fayase.
Oh, Fayase for my being. Yeah, most likely the all kinds or it's a breast accumulation there. Sometimes in duct ni be one ma unse like I say a breast milk they develop in the duct tubes duct tubes now say can me yes idea but maybe next me present this idea me say the way would the figure is a grape so offer grape of a bunch of grapes the way a berries not like a tradition and then a duct tubes and a berries and then a so a stem be so and then duct terminal duct it in a sonifem breast milk sonifem sa na akọ lactiferous duct na ability to a nipple and oba bi ono ma na a baby in air channel some of the lobules in group of ducts in one ma they are not getting emptied into na formal lump until fill lump be one. What you can do is say massage it. Or massage a bois a fancy breast milk a flow. Or massage a boss a better can feel lump.
Yeah, me question and I'm one breast implant. Because now can say so breast in a thicker. More test is hard to detect.
Yeah.
Now, my breast implants, I mean, first of all, does that contribute? Does that, is that a risk factor? And as a risk factor, and so does it, but does it limit the chances of detecting?
It can interfere with the detection.
Okay.
And with a very good question, I was will be saying, yeah, and as a film kakra say oba akoshe or say person enu fu yefe nti or akoshe implants na cancer sa abam yes say you 2 implants and you try enu fu so asa to watch bi it can mask it but so implants krana or implants krana still no the screen ne dey or so koso ye mammography no or so koso ye because mammography no the major strength in it is a comparison. They compare previous ones. And then they may it me the picky. Or implant in the crown and I'm so previous mammogram images into compare with and changes be by it me picky. but obstruct obviously and natural and it doesn't help.
Yo, doctor, I'm running to that questions in the income, but you say time or no? Is it passport for no ballroom? What ballroom I just say? I'm a bit on the console. And Ibrahim, I just say fry Ibrahim, yeah, you're about to tone there. You have more time to crabby, Nanyamboa also, but I'm more 2 minutes into Mr. Wan. The overcoming on a compressor, for the compressor into one sentence, never break. Doctor, yabado was a baby. Number next week, of course, the best out was not the one so. As I did, bra. And the according to talk a crab by a buy and one just say transition. The doctor to the mechanic. So to time that I discussion baby.
My main cancer next week maybe answer a better presentation be an even time for breast cancer questions.
Yes, questions in the more than that. Because men will be
training in the amount for be sending on trade.
Yes, the baby in a bands and sana yet was. The young Gajan Kratwamana, your transition to Mohammed because another Mohammed,
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid health insurance program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, what's if was a mokaba bill? Most corner, and I mo. Oh, arrow. I'm so what me too on the arrow, na bram kakana, and then the passports, Omujana, Gosimo, Wawoni Pano, but it was all my time. To Mr. 2 minutes. 2 minutes. The Sraw, that's what Grammy here. A defense, Dr. Furin, I'm more time. At the men on 2 minutes. The Akanyan, focus freezer. Yambo, and that's Kinadia bar.
Kwame, ohese na misi bo mitrinko na. I say akwa bia oye hustler na ne call fried rice na. Onya 10 cents akoto fried rice na ewie. Odiwe o say when come koto mo one cup anka me mia me biaka. Ama. Ejebo ene are ho pa say menya time because enen se no emodu pa na are ho eni die and it's very sad and so yebe find say I say akwasini mo juma odibedi enya sam keto a na kwa o de breast na some doctor say ye function next week because squad go macho mu bisa nsem me fama mo but o de ye function next week
next week ye best spend time kakra na me questions na doso most na na me ma de mo nom no fo no
bebre kwa yeah doso pa te men kan yes e didi ko me am time mu kwa me
aka 1 minute
Ghana for ninja Kwame COVID vaccine no ya hwe ni musa nyame adom COVID vaccine di biaba na ebi bae no afide nipa do ebi ko fine ama Kumasi cried here. You shall say last week Friday. You shall say last week Friday. You go so I was throughout I think Wednesday nyame adomana ebe ende and crying for so be share omo dia say nyame bo ochena e na akakra for so be share omo vaccination asena dia etene say
and granny akra no difference in say.
sorry but I cry and crying I cry of course by the time not about minister Mr. Mbacho fire pressure it's no yeah sure and anymore kwame na unim say covid vaccine na me pa Dr. Fori Chow said Dr. Fori pa no nyim na sikanamanfo didi jan asem we makasa Dr. Fori nti menim say akwasi ni modi me ka che na obedi hujuma me say mo munya bibi fa na vaccine sika na yesu nya bi ni because sikana amanfo didi an edidi Kamea said now no Ghana penufo enyom ba kwa moto ne say ye pia ko bontin disi edisi ka ba fie and one esa anyom na omoto because now sikana omde come shake no shake say after all this sikana man but still people are still calling on the health minister say on resign and then they are even asking say what's the evidence say indeed sikano or the aba na so or the aba no or kama Ghana for any age keke and assessing why it's been on and off adia etiwo covid vaccine no but me afraid you know me den sama hihema ma emu ayema you know they say me hu dia me ye film dia ma etiefo and dia me san fa nko fridge na next week me dia ba
fadia kan nyina akoshim yes fadia kan nyina akoshim number next week na dia ba because me time no already no we time no 12:01 hour Chicago which means there's a passport started that. The Mohammed, you better was a baby. Open train, never sponsor no so. They say health in the day. They say no, your time so. And that's therefore Hannah never be a come here to the mother in the Rano Abba. Number same time next week, you know, you must have a bank. There they will be also Abramo. Dr. Atona Moten cancer or they in a brain or church breast cancer. Of course, Dr. Forrest Bomachidom. Then Mohammed is so free Ghana. The man be about 2 minutes also about church and Adjunct. I'm the comments by Dr. Dan Somo. Just say, let me and carrying you need a pact. Just some more fancy. Number next week, you know. The band and you go through near yes or 3 out. You're doing Abramo. And from the series of alcohol radio, most of Fukwamanu. I intend to Macramo.